Good morning. We are halfway through the week. My goodness, this week is going by quickly. Hopefully you are having a good one. So glad as always that you can be tuned in to us here on 3+U this morning. We're going to kick the show off actually on a bit of a medical topic this morning because many of you probably know someone, perhaps you yourself, deals sometimes with chronic pain that can be a real difficulty as you go through your day-to-day living, and they're very well aware of that at the Center for Sports Medicine. So it's a great time for us to have our show bring in Dr. Ben Geddes, who is a physician there, a spine surgeon at the Center for Sports Medicine. Nice to see you today.
Thanks for having me on your show.
Always when we talk to your different doctors there on the staff, there's something new that we can factor into our conversation. I think it's great that this morning, besides talking about what y'all are doing that's kind of revolutionary to help with chronic pain, is talking about the team approach, because you really don't like to isolate one physician over another. Y'all do work together as a team.
No, that's right. I think if you look around the country at some of the top places that provide spine care, it really has become kind of a team sport. And there's a lot of reasons for that. But, in general, most patients that come in and have neck pain, back pain, or the radiating pain that you get from pinched nerves, most of them don't need a surgery. And certainly myself as a surgeon and other surgeons that we have in the group can handle those problems. But a lot of times, you need other things. And so having a broad team of people that provide bring a little something different to the table can be really helpful in providing care for patients.
And I guess I'll bring the layperson's approach to it because I have not gone to medical school, but I'll talk to you as the patient a little bit this morning. Sometimes it can seem, because medicine does seem to deal now, luckily for us, in such specialty realms. So if you and your studies have focused on specializing in spinal surgery, is that where you rely on the other members of the team who found a different specialty and y'all can consult?
Yeah, absolutely. I mean, I think, all the people on our team, whether it's the surgeons or we have several non-operative interventionalists who do injections, as well as therapists and social workers. Everyone has some understanding of spine pathology or spine problems, but have different expertise in the particular treatment areas. For example, we just added a new element to our conservative care, which is a type of therapy. It's called ACT therapy, or acceptance and commitment therapy, which is just another, relatively unique in this market thing that we can do that helps patients with chronic pain. That's just, typically once you're in chronic pain, your treatment options are more limited and success is more limited. And so this is something that we've sort of added to our arsenal to help with this kind of challenging, patient population.
I guess some people, I used to be in this camp, would think of a spinal concern being isolated just to your spine. But the truth is, if you've got a problem, it can radiate to other parts of your body. Is that right?
No, that's totally correct. I mean, there's really kind of two components, honestly, to people that have pain, especially if you have pain for a while. There's the physical part, which is, as a doctor and a surgeon, kind of what we focus on. And that can certainly can radiate, just like you said, kind of the classic, layman term is sciatica, which really for us is just a pinched nerve either in your back or your neck that causes arm or leg symptoms. But there's also this psychological component. I mean, if you're in chronic, if you're in pain for a long time, it does change the way that you think and behave. And so that's where some of these other modalities like this ACT therapy can be helpful, where it kind of combines, normal conventional physical therapy with some more of the psychological side of things, which also is important for these types of patients.
I'm sure as a surgeon, you have some patients who come through your door and you see right away that surgery is going to be really kind of their last option. But I'm also guessing that it's not your first choice when you see someone.
No, that's exactly right. I mean, we have kind of this philosophy here at Center for Sports, which is where we kind of say that there's a therapeutic ladder, and what that means is, we try to start at the bottom when appropriate. There are some emergencies in spine, and certainly we deal with that. But for the average, arthritic or sciatica type symptoms, we try to start small with some therapy, some medicine. That'd be kind of the first rung. And then you work your way towards injections, which are more invasive but not a surgery. And then ultimately, some people do need an operation and can do very well from that. And then those are the folks that really, they need my expertise at that point. So
if someone comes into you and they've been living with some chronic pain, but they're just now coming to see what they can do about it. And you say to them, you know what, let's try this more conservative approach, come back and see me in 6 weeks. On the one hand, that's good that it's conservative. On the negative side is that they're going to be left with the pain for 6 more weeks. So does that ACTS therapy jump in at that point to kind of make those 6 weeks more manageable for them?
Yeah, I mean, I think probably the ideal patient, a lot of times, when we try this, in your example, we do 6 weeks of some conservative care. Typically we've prescribed some medicines, steroids, anti-inflammatories, and a lot of times those things are enough to kind of make the symptoms kind of go away and kind of quiet down. So a lot of times, even though we're waiting that 6 weeks, by the time they come back in 6 weeks, they say, "Hey, thanks. Like I feel better." Mm-hmm. And so they're not kind of miserable for that whole 6 weeks. But for the people that are not getting better from those other things, and especially if they've had chronic issues, chronic pain for a long time, then that's where really that ACTS therapy can be a helpful adjunct to their treatment.
Okay, I know you've got patients to go see. Let me see if this can be my last question for you this morning. There might be some people watching who know clearly what they need is you as a spine surgeon. There are others who might not be quite sure what's causing their problem. Could they go to one of the other physicians within Center for Sports Medicine thinking that perhaps they have a pulled muscle, and if it's something more than that, that doctor will refer them over to you?
Oh, absolutely. I mean, and that happens all the time. Someone goes to one of our joint surgeons because they think it's their knee, and it's actually a pinched nerve in their back causing the sciatica. So we're constantly reevaluating and kind of getting patients to the right place. We're pretty good at triaging on the front end who needs to see what, but certainly communication between all the various subspecialties, it's very easy to get people to the right physician.
If you have never been to their offices before, if you go to the one on Macaulay anyway, you're going to be kind of wowed because it's like this city, this highly functioning city when you walk in the door. It's always interesting when you come through there. Good to see you, Dr. Ben Geddes. We appreciate your time this morning.
Oh, thank you. I appreciate it.
You can find him and the team at 2415 Macaulay Avenue. The phone number there, 624-2696. In no way is that the only location, however, in town. If you go to sportmed.com, you'll see all the other locations where you can easily access the physicians at Center for Sports Medicine. So glad that they're here. Thanks again.
I'm Liz McLaughlin in Tokyo. Every evening on Channel 3 at 5:30, I'll bring you the memorable moments from the Olympic Games.